Again, I'm speaking on behalf of my wife, Aruna Sharma. Here, the question is sleep deprivation. That you know that is quite frequent in male, and how it can develop neurodegenerative diseases like Alzheimer's disease, Parkinson. This is a big problem. And as I told you, that this research is supported by Department of Defense, European Aerospace Research and Development, United States Air Force Research and Development, and many other organizations. It is a multilateral collaboration among participants, and they are rather constant in most of our investigations. The authors, not for any institutions. This is our responsibility. Sleep disorder is one of the most dangerous situations in hospital workers, nurses, military populations, and people who are working in different various shifts. And one of the most important causes of brain atrophy, Alzheimer's disease, accumulation of amyloid beta, phosphorylated tau, mitochondrial dysfunction and oxidative stress. And here you can see that how Alzheimer's disease can affect our neural tissue. This is an example that various genes are involved and causing neurotoxicity. This is an overlap between Alzheimer's disease and Parkinson's disease. Alpha-synuclein, tau, amyloid beta, they are in the middle. This is an example that can affect every individual, how sleep deprivation can affect impaired cognition, increased symptoms of depression, increased risk of breast cancer, increased risk for heart disease, weight gain, increased risk for diabetes, stroke risk, and higher levels of anxiety. Obviously, we have shown that how sleep deprivation can open the blood-brain barrier. As you can see that in 2015 was the first report, followed by 2019, and even 2020, and research is going on. Combat stress. As some people who work in military organizations, they know how difficult and stressful this is. There is one publication that showing sleep deprivation can affect brain like alcohol intoxication. You can see alcohol-induced brain impairment and sleep deprivation-induced brain impairment is very similar. This is our military conditions during combat operations. They are living in different conditions, very stressful, with sleep deprivation. That is normally recommended minimum 6 hours to 8 hours every night with good sleeping zone. So, these are amyloid beta peptide infusion and seen in different regions, nanowired cerebrolysin significantly reduced it, and also the albumin immunoreactivity. This is again the example that not only neurons but also the astrocytes and microglia are affected. At electron microscopy, you can see that this is serious distortion of myelin and damage that was reduced by nanowired cerebrolysin infusion. Another example that even in diabetic conditions, they are much more aggravated. This is blood-brain barrier in Alzheimer's disease, also in this traumatic brain injury. And we have shown that even not only nanowire but PLGA level cerebrolysin also influence similarly. But nanowired deliveries are the most efficient in this case. This is an example of temporal cortex pathology, and you can see that ADP plus tau plus antibodies and nanowired cerebrolysin has protected the brain as compared to the untreated. This is also the example here, nanowired cerebrolysin plus amyloid beta peptide, and then we have the antibodies to amyloid beta peptide. They are producing much better. It was one of the awards given in 2016 to my wife on nanowired mesenchymal stem cells and in sleep deprivation. We have biochemical measurements of cerebrospinal fluid and brain parameters. You can see that amyloid beta peptide, phosphorylated tau, even serotonin are significantly reduced when we have given nanowired cerebrolysin plus antibodies to p-tau and 5-HT antagonists, the lowest line. We have given sleep deprivation, and after that, inducing amyloid beta peptide to develop Alzheimer's disease. You can see that untreated, many neurons are damaged, but the treatment has significantly reduced them. Not perfectly, but compared to the damage, they are much less. We don't know it is reversible or irreversible. This is the example, electron microscopy, that untreated sleep deprivation plus amyloid beta peptide, and here the treatment is able to considerably reduce the damage. This is the hematocrit stain neurons, and after treatment, they are significantly reduced. This is in brainstem, different area. This is also significantly reduced. Amyloid beta peptide, this is also significantly reduced here. CD86, much more aggravated, and here it also reduced. At electron microscopy, you can see one axon, for example, is very much damaged, dilated. Here it is considerably reduced. We are also working with Nobel laureate Andrew Shelley. He has small fragments of peptides that we would like to nanowire delivery in various cases to see if they are neuroprotective or not. These are the same I have shown you. We advocate nanodelivery of drugs. Thank you very much for your kind attention. Thank you.
If anyone has any doubts, you may ask Professor about your queries.
Just a question.
Yes, please.
Does anyone know the mechanism? So you have the sleep deprivation, and you can talk with us and so from a biological state to morphological change. So do you know how it's related or how it's starting?
There is one report that even one night of sleep deprivation enhances amyloid beta peptide. Only one night.
The peptide itself,
it is neurotoxic. We still do not know that this is the cause and effect. There is a lot of speculations and discussions in the scientific literature. But the one thing very important, that we have shown that even 8 hours of sleep deprivation opens the blood-brain barrier to restricted region. When we enhance up to 72 hours, it is the whole brain, mostly 90% is broken down. And they have measured with E1 albumin, very big molecule, almost 78,000 Dalton. So it is very big hole, and that produces edema, that produces obstruction of blood flow and ischemia. Therefore, this is the one way of the degenerative changes are already entered into the brain after sleep deprivation. But also there are reports that when the people have excessive sleep after the sleep deprivation, the symptoms may disappear very